Hey, good afternoon. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. I want to welcome you this afternoon to our session, Managing the Impact of COVID in the Historically Black Colleges and Universities Community. We're so excited for you and to have you this afternoon to join us in our inaugural session. I want to share a brief background about the work of Community Campus Partnerships for Health. We're a 25-year-old international organization that has distinguished itself in the space of building authentic partnerships between academic institutions and the community to address issues of health equity and to advance social justice. As the Executive Director of Community Campus Partnerships for Health, it's been my pleasure to really advance our commitment to both health equity and to social justice. In particular, I want to acknowledge this afternoon that I am a proud graduate of a historically Black college and university, Livingstone College in Salisbury, North Carolina. And it's really with that commitment to HBCUs that 3 years ago, as we were moving into the RIDEX Up project, which is the largest COVID-19 testing project funded by the National Institutes of Health, that we envisioned an opportunity to connect with historically minority serving institutions to really better understand the impact of COVID-19 in their respective communities. Why did we focus on HBCUs, tribal colleges, and Latinx institutions? Well, our primary commitment to that was the fact that we are graduates. Many of us who you will hear this afternoon are graduates of HBCUs, but also we understand that all of these institutions, both HBCUs, tribal colleges, and Latinx institutions, historically sit in communities that have been marginalized. There's also issues around residential segregation and redlining, such that these institutions sit right in the nexus of health inequities and health injustice. And just for us, it just made sense to really connect with these institutions to really better understand their role in addressing COVID-19. I want to recognize and acknowledge our team members this afternoon who are joining me. I hope I can get all their names right, but you'll meet them as well a little later on. I want to share, though, the agenda for this afternoon. Again, I'm Al Richmond, Executive Director of Community Campus for Partnerships for Health. We'll have presentations by Dr. Moore from the American College Health Association COVID-19 Task Force. We'll then move to a presentation, a joint presentation by Dr. Payne and Dr. Murdy, who will talk about managing the impact of COVID on HBCU communities. We're also fortunate to have one of our team members, Magdalene Wellman, joining us this afternoon, who will share with you about an amazing funding opportunity from RIDEX Up that we want to share with you this afternoon. And then we'll have some announcements. This is an informal session. We encourage you to chat in your questions. We'll get to those at the end of the session as well, and even may have an opportunity to go live with some of those questions. Again, welcome to our inaugural session that's part of a series of webinars. I want to acknowledge my team members, Virginia Hunter, who's the HMSI project strategist, a proud alumni of Central State University in Ohio, Trey Mackey, who is received his master's degree actually from Morehouse School of Medicine, Nyla Whitaker, who is a stellar student at Spelman College in Atlanta, who's been interning with us this summer. So as you can see by those introductions that we're proud HBCU graduates, and for that reason, we're so glad to have you and we welcome you this afternoon. A few ground rules. Again, this is an informal session. We'll have some presentations by our speakers and invited guests, but we also encourage you to be engaged in our conversation this afternoon by sharing questions that you have. To get us started, what I'd like to do is for you to just quickly chat in the chat box the colleges and universities that you represent. So let's just have a chat storm here this afternoon and chat it up. And we want to know who you are and where you're from. So take a moment to introduce yourself virtually. And we'll call those institutions out. So we're waiting on you to take a moment to introduce yourself. Prairie View A&M. Others, Central State, Morehouse, Spelman, getting you started. Fort Valley, welcome. So please continue to do that as we move forward. We, again, want to know who you are and what institutions you're representing. I also just want to acknowledge other CCPH team members who have joined us this afternoon. Our first speaker for the day is actually Dr. Tondra Moore. Dr. Moore is the Executive Director of Health Services and Health Administrator at the Owens Franklin Health Center at Prairie View A&M University. She's a new friend, and welcome her to share more about her expertise in the area of working with HBCUs, in particular around health issues. Dr. Moore, welcome and take it away.
Thank you, Mr. Richmond. Slides, please. Okay, so I actually am here today representing the COVID task force. I am a member of the task force, which was formed in about February of 2020 by the American College Health Association. Next slide. And as Dr. Richmond said, I am Tondra Moore. I'm the Executive Director for Health Services. I do like to sometimes give a little background on what that means because it is different at different institutions. So here at Prairie View, as the Executive Director for Health Services, I actually oversee 4 different departments, and it's getting cut off on the bottom of the slide, one of the departments though, but I have the Student Health Clinic, Student Counseling Services, the Office of Disability Services, and the Emergency Resource Center, which we've called the Hilltop Reserve here. And in my current capacity, I also operate as the Incident Commander for the University for the COVID-19 pandemic response, as well as serve with ACHA as the HBCU Coalition Chair. And so the coalition, the HBCU Coalition, is actually a group of individuals who simply support issues and promote agendas that help to improve the health of students attending HBCUs, but they do not have to be individuals who work at an HBCU or currently attend an HBCU. It's simply just about a joint mission and vision. Next slide, please. A little bit about the ACHA. So the ACHA is an organization that's been around for over 100 years now. And recently, the COVID-19 pandemic allowed the institution to really receive some prominence that it had not had in previous years for its ability to actually help set the national agenda when it came to how to serve individuals, because we had to make sure that those individuals making healthcare policies around COVID-19 truly understood that individuals who work at colleges and universities serve such a large and diverse set of stakeholders that we had to have some specialized attention on addressing the issues and concerns that we've had. So with that, we actually represent and serve over 700 institutions and more than 7,000 professionals who work in some capacity of college health and wellness. Next slide. So as I mentioned, we actually were able to have an increased level of prominence, and partially because of the partnership that the ACHA, through the work of the COVID task force, was able to create with the CDC. And so with this partnership came the ability to help, now, like I said, inform policy, but also it brought along with it direct funding that came to the American College Health Association that allowed them to start different initiatives such as COVAC, which is the Campus COVID-19 Vaccine Initiative, which allowed money or funds to be directed to institutions that were specifically looking at issues that impacted college students, and also to help craft tools and resources to help those at institutions who may not have had the ability. So there's a wide variety of resources that are available for all colleges and institutions to actually tap into because of this funding through CDC to ACHA. So it's not just limited to individuals who are members of ACHA on the resources that are available. And I want to make that very clear because sometimes our historically Black colleges and universities don't have the resources or the financial means to create some of these tools that we have had experts across the country create that are available for your use. Next slide. I want to take a little bit now. I want to acknowledge that the source for this did come from afloat posters. But I got this graphic because I thought this was an excellent depiction of HBCUs and where the majority of us sit. And this graphic shows us the majority of HBCUs sit in areas or regions of the country that typically do not support some of the stronger public health mitigation strategies or policies that support public health mitigation in a way that is more aggressive. And so with that said, the colleges and institutions who are situated in these areas do face a unique set of challenges when it comes to actually responding to the COVID-19 pandemic. But with that said, also, these institutions need to make sure that they highlight the work that they've done because many of them were open long before other institutions were across the country. Therefore, they found the need to really be creative and innovative and create strategies to address the pandemic on their campuses. But that is valuable knowledge that once shared, other universities can benefit from and should have that opportunity. Next slide, please. And so with that said, I want to tell you a little bit about what we've done at Prairie View. And so these are just some graphs here, some pictures here, I'm sorry, to show you some of the work that we were able to do. And we were very proud of the work that we did because we often had to respond in with a very quick turnaround, with a very clear directive, but not as clear direction or strategy on how to approach it, simply because we had not had to address anything of this nature or magnitude at one time. And so what you have here are some pictures of one, return to campus testing. Last fall, we had great guidance that really suggested that we know the status of students before they return, because at that time, we did not benefit from really having strong, the presence of the vaccine on campus. So we actually had rapid testing where we tested over 3,000 students who returned to campus, because unlike many campuses, we were open and ready for business in the fall of 2021. And we needed to kind of have a grip on what was coming to campus so we can know how to respond to that. And what was also excellent about this opportunity was that it did not just give us the chance to see what was on campus, but it allowed us to help some of our students on campus who had some struggles. Those students in particular would be the ones that you see in the blue isolation gowns, because those are our nursing students. So one of the challenges that many universities face and many HBCUs also face was that students who were in programs that require clinical hours or clinical engagement were limited in their ability to engage in some healthcare facilities. They were limited in some clinics. So they really struggled to meet the needs, the requirements that they needed to be able to complete their program successfully. So initiatives such as the return to campus testing, the vaccine clinics that we offered on campus allowed us to give our nursing students these opportunities to come in and get some clinical hours actually serving patients and patients from not only the campus, but also the local community. And so that's a wonderful way to show how the resources at an HBCU can be used to help not only the students, the community, but the students in a way as far as their health, but also educationally as well. Next slide, please. Now, I wanted to take a quick second to do an analysis of some of the strengths that we saw from HBCUs during this pandemic. HBCUs did not just survive the pandemic, they have thrived. And we need to make sure that we acknowledge that and that we highlight and actually regularly celebrate that. And some of the ways in which we've thrived is that we've seen increased funding that came in through the CARES and HER funds to institutions that was extremely beneficial in allowing institutions to pivot, and to also excel and leapfrog in ways that they had not been able to do before because of the lack of resources. You also have seen institutions that benefited from some great debt relief, record enrollments across the country. And we have to recognize that some of these record enrollments are really in response to the political climate and the social justice climate that we are struggling with today. But that's been a benefit to us because while it was highlighted during the pandemic, it has allowed our institutions to really create that safe space for students to not only come in and thrive, but to feel as if they have a place where it's a safe and a sheltering environment within the storm. And some of the weaknesses, we have to still acknowledge that many of our schools still struggle. So it's excellent that we're going to have a presentation at the end about funding resources. And we need those because we have to continue to make some strategic growth and investment in our institutions to continue to thrive after this pandemic. There are many opportunities for funding with research, but also many opportunities for us to really take the helm when it comes to leading the research in looking at how COVID-19 will impact underserved populations. We already are experiencing and seeing that long COVID is really displaying itself in many different ways that researchers could not fathom. But we need to make sure that we have a strong hold on that in HBCUs to help lead that research, because leading that research ensures that we lead the narrative. And lastly, I wanted to look at some of those threats to these opportunities, simply that we have to still continue to address the social and political discord that we are experiencing here in the country. HBCUs often are bastions of safety and security. They're that home away from home for our students. And we have to become more vigilant in being at the forefront of leading some of these discussions. We were able to see that some of that discord really did cause confusion for individuals trying to figure out how to navigate the world with COVID, with the change in policies and how that impacted and affected them. So it's very important that we take the lead on being a part of that policy making process so that we can help individuals and our stakeholders make their way through dealing with this social and political discord. Also, misinformation and disinformation. While that is definitely not new to healthcare, the way in which it has impacted our ability to actually help individuals navigate the uncertainties around COVID has been like none other. The emergence of social media and the way in which information is able to become viral has really outpaced the virus. Misinformation and disinformation is something that all HBCUs must really take a strategic approach to addressing on their campuses in order to ensure that students understand the importance of the information that we are sharing to help them better their health, so that they can have better success with matriculation as well as in their future endeavors. We have to make sure that we are helping to create the narrative to provide the foundation, the resources, and the references for them when it comes to understanding all of the information that they are bombarded with social media today. Lastly, we still have to deal with mistrust in the medical and healthcare community. COVID-19 has really done some work on the trust and mistrust that we had spent many years working to repair within our communities. We still have to think about the fact that even though we serve a constituency that will trust us more, the misinformation and disinformation has been targeted at certain communities. certain underrepresented communities. Therefore, those communities don't have all of the information that they need, and their trust in you may have diminished some as a result of the pandemic. So we still at HBCUs have to do the work to ensure that our stakeholders, that our patients, and that our students still see and trust us as resources to help them improve their health. Next slide. And so I just wanted to leave you with a few things that I think we all need to keep on our radar. As far as vaccinations, HBCU campuses, we must continue to encourage and provide the vaccinations, but not just for the students and faculty. Many HBCUs became the resource for vaccinations across their communities, and we have to remain to be a strong and positive part of the communities that support and surround our campuses. Long COVID, we have to determine how to operate with COVID as a permanent factor on our campuses. Many of us will have to figure out, how do we operationalize what isolation and quarantine looks like for us? What do we continue to do with individuals that we know will be positive? How do we move forward? Also, how do we provide students with the resources that they need if they are experiencing some type of health issue that is related to COVID? How do we create policies and procedures that allow students to really benefit from the fact that we don't know everything about COVID or long COVID and how it will represent, but that we are here to support them with the best information, always staying up to date as best that we can to make sure that we provide the resources that we need. When it comes to mental health, our students are experiencing mental health struggles at rates that we have never seen before. COVID has really exacerbated that on our college campuses. Many of the campuses are also suffering right now because they are losing the employees who have once served those students because those employees are burnt out. So we have to do what we need to reinforce and to really gird up the infrastructure around the mental health resources available on our college campuses to make sure that students have not only know what resources are available, but they also have resources available to help them manage with their current struggles. Misinformation and disinformation, campuses must be strategic about addressing that. You need to make sure that you have strategic plans in place to really bombard the social media waves that your students are regularly engaging with factual information that they can use to help improve their overall health. They need you to be a voice that they interact with and that they hear from regularly. And lastly, campus leaders must address employee burnout. We have to look at the campus environment that has supported staff burnout because of the things that we have unintentionally made a part of the culture, and address those from a system level approach that will allow employees to see that their health is just as valued as the health of the students. And some of those things that the leaders can address are issues with compensation, appreciation, workload and work-life balance, and also new employee expectations when it comes to that balance in life. Many college campuses are struggling right now when they figure out, how do we allow people to have remote access or to work remotely, but also offer services while we're here on the ground. We have to figure out their balance because we have to help not only the students, but also the employees. Thank you. And I'll have questions at the end, I think.
Dr. Moore, thank you for that phenomenal presentation. I was sitting here just thinking about the fact that as someone who's been out of college for years, many years, the challenges that faculty, staff, administrators, and then the students have in this current environment. You really did a phenomenal job in contextualizing where we are in this moment. Thank you so much. One of the comments that you made that stood out to me also is this idea and the importance of restoring the trust that has been diminished as a result of COVID-19 and misinformation. So thank you so much for really kind of contextualizing it and framing it and really grounding us in some issues that are so important. I recognize that we had some challenges with our chat feature. I think those have been corrected. We encourage you, if you've not done so, to please put in the chat box which HBCU you represent. On the screen now are available resources that Dr. Moore is sharing with us from the American College Health Association. So we thank you for coming this afternoon in your dual role as a staff leader, administrator at HBCU, but also from the American College Health Association. We encourage you to use the chat box to share any questions that you might have, and we'll address those at the end of the session. I want to now introduce Dr. Payne and Dr. Murdy. Dr. Payne is a professor and chair of counseling department, the College of Education and Professional Studies at Fort Valley State University, and Dr. Murdy, who is the Alma Jones Endowment Professor of Social Justice and chair of the Department of Behavioral and Social Sciences at Fort Valley State University. One of the things that when we were looking at the lineup for today, it's an amazing lineup of representatives from professional organizations and HBCUs, but also it represents institutions of what we say west of the Mississippi. So we're so glad to have you joining us today. And we want to turn it over to you for your presentation. I think, not sure which one is going first, Dr. Payne or Dr. Murdy.
Oh, that will be Dr. Payne. Thank you.
Dr. Payne, welcome. Take it away.
Thank you. So we just want to say thank you for having us here for the as panelists for the session. So again, I'm Dr. Tamara Brown Payne, and I will be joined by Dr. Murty, Komanderi Murty. And so for us, we came in because we published an article. The article was the parallel to pandemic of COVID-19 and racism and how HBCUs are coping. And so it was really good and fit for us to have this opportunity to present the information that we have in regards to what we're doing there at Fort Valley State University. Next slide. So what we wanted to do is we wanted to basically talk about how we were preparing for the future of universities. And so our president, Dr. Paul Jones, he, at the request of our provost at the time, that was Dr. Stewart, we wanted to invest in seeing how we can continue the learning for our students so that our students would be able to continue their studies during this whole COVID pandemic. And so what happened was we purchased the equipment for classrooms to make them capable of having a blended synchronous learning. And so this allowed for us to be really ahead of the game when the COVID epidemic started. So we were able to get the students to get from face-to-face basically online. And we made sure that once we did online, we were preparing for the fall so that during the fall, our students would be able to continue with their classes. And so we purchased this equipment to allow for students to have the option to do their classes online, or they were able to come into class. And so the professor would come into class. With all of this, of course, we had made sure that we put the precautions in for safety and sanitation. But what it did was it reduced the number. So we halved all of our classrooms so that the students were able to come in. And so a class that usually would hold 40 would hold 20, or 20 would hold 10, so that we would be sure that everyone in the class was still getting their lessons, but also that everybody was being safe. So of course it's blended synchronous, which means that if the class was at 10, the students online would log in at 10, and the students that came in class, they were at 10. And this was very seamless. We made sure that all the faculty and were trained. At that time, I was the director for the Center for Teaching and Learning. And so we did that whole summer, and we made sure that all faculty knew how to work the equipment and knew how to actually do the blended synchronous learning format. From at that point, the president saw a need to prepare the university for just some adverse events, not just with COVID, but just looking at the upcoming years. Because, you know, what we did find was planning was key. And because people really didn't have time to plan, we had to plan as things were going in process. So now it's saying, okay, now we see what's happened. So now we know we need to be prepared. So in doing this effort, we have the business continuity plan, which we call the BCP. And it was designed to basically identify some team members, and that would consist of some faculty. It would consist of administrators as well as some staff, so that we can implement some ongoing strategies. And so we did this in October of 2020. Next slide, I'm sorry. All right, so some of the objectives of the BCP was, one, we wanted to minimize the loss of university, and that was for students as well as for faculty. And so we wanted to look at, well, how can we retain students, and how can we continue to enroll students? How can we continue to maintain our faculty and staff that would be at the university? Of course, funding. And so that was one of the major objectives that we were looking at. 2 is to ensure the continuity of instruction and the quality of service to our students and other institutional constituents. And so we needed to look at, well, how could we continue continue providing the quality education for our students, as well as making sure with financial aid, making sure with housing, making sure that the students have their activities, and make sure that all of these things would still, again, seamlessly flow just as it would prior to COVID. To resume our administrative operations efficiently, again, to be sure that all of the services that we were providing for our students, faculty, and staff, that was still continuing, and making sure that it was going to be efficient enough so that everyone can have the quality of what they needed with the services, with the supplies, with the, again, education technology. 4 is to facilitate awareness and training, accountability, data accuracy, and resilience, and financial assurance. And so again, we wanted to be sure, a main thing that we did find was training was key for everyone to understand that shift going to with technology, with shift of that operations had to change, to look at, we needed to make sure that we maintain the data and utilize that data to find out what needed to be improved on. Again, to understand about accountability, so everyone knows what their responsibilities are and what needs to be done. 5 was to conduct a research analysis to the mission critical functions of each of the administrative units on campus, combined with the strategies and responses required to resume and or recover stable and secure business functionality in the event of a significant disruption of services. And again, the main thing is making sure that we are being prepared, making sure that we are still following all of the things that we have in as far as our mission and what we are supposed to provide for our students. Then we have 6 is the to provide guidelines for a more sustained university-wide disaster response. And so this is very helpful, because what we needed to understand was in an event that we had to shut down the campus, in the event that we had a stream of individuals that, the students or faculty that received COVID, that this would be something that we needed to be prepared for. Of course, currently, students are able to get tested on campus, but what would happen if we had a high amount of students that had COVID, or we had a high amount of we had administrators or staff members or faculty members that had that. We have to be prepared for something like that to happen. And how do we keep going forward? And so that was, again, a main thing that we actually wanted to be sure that we looked at when we're looking at this plan. Next slide. Dr. Murchie.
Good afternoon. Thank you, Tamara. That was very good. I was hoping that you will continue. But before I start, um, I just want to let you know Fort Valley State is kind of a rural campus in the middle Georgia. So some of the things we do are a little different from urban campus. I joined Fort Valley in 2009. Before that, I was at Atlanta University, then Clark Atlanta University for over 25 years. So I'm glad to see some of our colleagues here from Morehouse School of Medicine, Spelman College, because I worked on all those campuses at some point or the other. Now, coming back to this business continuity plan, the implementation has about 6 phases we call. One is the BCP testing, then pre-planning phase one, then we call pre-planning phase two, work plan process and reporting phase one, work plan process and reporting phase two, and then review modification for next year implementation. We are at the pre-planning phase one because this is where we try to plan something and test what works, what doesn't, and modify the plan. And then we incorporate those enhancements in the plan and test them again to make sure they all working. And this is like an ongoing thing. And this actually addressed not only just COVID, but a lot of natural disasters, any violence on campus. Our prior presenter talked about mental health and burnout. And in any of these kind of disasters, these seem to be very common effects. We see students' mental health, faculty mental health. When the other day they had a bomb threat. HBCUs have been affected by bomb threats, these days after COVID. So everybody get really panic and mental health, campus shutdowns. And then once in a while, people run with the guns. Once in a while, they run into dorms with some knives or something. Even though it's not as much as urban campuses, still it is nevertheless happen on the rural campuses as well. And the burnout is also come from two different sources. One, not only because of this increased workloads and disastrous things, but also because of the budget cuts, because we now are facing the stopping this new funds coming from after COVID, and then enrollments are shrinking, so the state funds are going down. So with that, we can't fill the positions that were vacant, they froze, and the faculty, whoever is remaining, has to take additional loads. Same thing with staff. So the workload increase plus all these other requirements because of the disaster certainly increase the burnout among the employees. Next slide. So as I said, this emergency plan is thought to increase the resilience in an institution in case of unforeseen disastrous events. Some of them are acts of nature, like tornadoes and hurricanes. Some are man-made disasters, like terrorism, like I mentioned about bomb threats and things like that. And health crisis. Now we're talking about COVID, sometime back we talked about Ebola. Now they are talking about monkeypox, whatever that's coming. And technological failures, one of the big problems with HBCUs is the digital divide. We end up buying so much equipment during this COVID period, like Dr. Payne said, because we are very behind in the technological infrastructure of the campus. Some equipment was very old, some is not adequate, and the maintenance is not very up to date. So we had to invest so much money to bring this to make sure we will be able to offer quality instruction to distance learning, whether synchronous or asynchronous instructional procedures. So we are trying to see how we can make it sustainable over a period of time and not gravely affected by these kinds of interruptions. Next. Okay, in the part of this implementation phase of BCP, we have taken some initiatives. One, we are engaged in collaborative partnership with Atrium Health. You probably know Atrium Health has so many centers throughout Georgia. So we are trying to strengthen our capacity with that collaboration. And we have developed articulation agreements. In some cases, we actually renewed those with California Community Colleges, Georgia Military College, and Central Georgia Technical College, so that we can address adequately some of the enrollment challenges. We also started some new programs like BS in nursing, MSW, which were just approved. So MSW has this mental health and addiction specializations. And we have developed internship opportunities with Houston Medical Center, Navicent Medical Center of Peach County. So these are some of the initiatives we are now in the process of expanding. Hopefully, we also have our own behavioral health center. So we believe that these will actually help expand our health care initiatives and addressing some of the students' needs. Next. Okay, I think.
That's me. Okay.
Okay,
All right.
go ahead.
Thank you, Dr. Murty. HBCU COVID challenges. So in addition to looking at what the state's doing and how it is affecting our funding, we are looking at that we have to do some offsetting for the budgeting. Basically looking at the supplement for the health funds, that since that will no longer be available after May 2023, we're looking at a projected fiscal year 2024 of a decline. And so when we're looking at it, we're looking at the loss of the funds that we usually would get from the state, as well as additional funding. And so this would be a projected project shortfall of about $1.8 million for the school. The next slide. No, next slide, I'm sorry. Next slide.
That seems to be the end of the slides.
Oh, no. Okay, it was another one. I guess that y'all didn't get it, but so I just continue. And so just some other challenges that we, pretty much had. Again, we needed to look at, what effect that would have for us in regards to the technology, regards to providing additional services. So the slide that I guess I didn't get to get it on there is that what are we doing and where we are for the updates. And so some of the updates that we're looking at is one, of course, developing course programs. And so the courses are now making sure that we're developing a bit more programs that have an online or a hybrid format. So some of the programs we may have a face-to-face, but they also have an online format for the students, and then we're having combinations. So making sure that that's more available and accessible to students. What we do find is that some students are just not wanting to come back on campus. And I have a graduate program, and a lot of looking at the perception of COVID compared to undergraduate and graduate. Of course, because graduate, we have more older students, they're a little bit more hesitant about coming on campus. And so we still have all of our equipment. We're still able to provide blended synchronous. And so we wanted to be sure that if anything arises, the campus is still prepared, but also to allow the students an opportunity to still continue getting their education. But those that are saying, really, I don't want to come on campus and then, try to find another means to finish their degree, we want to be able to have that accessible for them. And so we're making sure that we are making sure that technology is being updated. Like Dr. Murthy said, that is a concern. A lot of times we can use this different funding to have that happen. One good thing was for Fort Valley is that we did get a grant with Apple. And so all of the faculty were able to get iPads. And so the purpose of the iPad is to allow for faculty to be a bit more accessible in regards to, you can take your iPad anywhere and you're able to log in and get onto your class that's online. You're able to still communicate with emails with students, as well as have it inside of the classroom and enhance the instruction. And also, it can also help those individuals who are hesitant in regards to technology. We have a lot of faculty members that they just really didn't want to embrace it. And so this would allow them to just kind of take the iPad home, can play around with it to try to learn as well. And then find out, for me, I'm an Apple, person. So I love just having my stuff everywhere and everything synced. And so just kind of making sure that the training is something that we continue going forward. And that's with technology, that's with different ways of teaching as well, so that we are being more creative. So we are being able to have the students to be more engaged inside of theirs. Last thing is also just looking at making sure that we're making it a safe haven for the students. We did talk about mental health. That's a major thing. So we do have the students that they're able to get access to mental health services 24 hours, 7 days a week. Of course, telehealth is very important. So we have that option available. Also, again, using iPads where security can come to the student. And they can have the iPad and they can actually talk to someone from their room if they don't want to, and we have what we call like safe places where they're able to go in and they can speak with someone. And so we're really trying to address those for our students. And so again, what we find is that there are going to be challenges, but again, it's about really kind of being creative with what you have. And as HBCUs, we know that we always have to be creative in getting funding and doing things. And so I think basically the thing is that we have to continue in doing that. But I think pretty much we've been really successful in all of our attempts and all of our practices that we have had in going on with this pandemic and other crises that we've had on campus. So again, I want to thank you, Dr. Murthy, and I would like to thank you for allowing us to present and just share just some information. So if you have any questions, feel free.
Drs. Payne and Murthy, thank you so much. I think from your session, really, you surfaced this issue around the broader topic of disaster preparedness. Dr. Murthy, you in particular highlighted the fact that we're in this season of increased health crises, more recently monkeypox, but there are others that are unfortunately we will see in the near future. So I think that it's important for those who on the call who are representing HBCUs to think more broadly and holistically about how to respond to health crises, both man-made and environmental, that are upon us. We want to close out today by providing an opportunity for you to hear more about funding opportunities available to you at your institutions. I want to welcome Magdalene Wellman, who's program manager for CCPH's RADx Up project, the Rapid Acceleration for Diagnostics for Underserved Populations. Magdalene, welcome, and please share with our viewers information about new funding opportunities. Thank you.
All
right, thanks, Al. First, I've really enjoyed learning from all of you all today, and hopefully these funding opportunities can be an asset for you all as you're trying to implement different things and pilot different things in your universities. Next slide, please. So as Al said, Radix Up is a project, Rapid Acceleration of Diagnostics for Underserved Populations. It's primarily focused on increasing COVID-19 testing and uptake, both uptake and access in underserved communities. And so Radix Up is NIH funded, and they offer 2 additional grant funding opportunities within the program for institutions and community organizations to apply for funding to support additional work that they would like to do. And one of those is the Rapid Research Pilot Program. And that program is a grant program that's looking to assess the feasibility of integrating these different test strategies and technologies in the communities that you're working with, whether it's your school community, whether it's a community that your school is housed in, or other communities. And really it focuses on 3 key areas. So if you are looking to do research or you are currently doing research that focuses on 1, identifying and addressing potential barriers to testing. So thinking about how tests are made available. Is it better to provide people tests and let them do them themselves, or is it better to have tests, that are done by a healthcare professional? Different areas around that. Also looking at alignment of testing with the populations that you're working with. Do the test methods that are available, are they appropriate? Do they really address the needs and even the beliefs of the community that's being served? And then finally, looking at testing workflow and access. Are tests easily accessible for the communities? How can they be made more accessible? How can we make it easier for them to be used? So different things like that. If you have, projects or research that you would like to further, kind of investigate these things, or you're currently doing some work with that and you would like to just extend your funding, the Rapid Research Pilot Program is a good option. It is a $200,000, you can file for up to $200,000 in direct costs for a 12-month time period. The applications for this cycle are due by September the 16th. And as you can see, there's a link here. I will also provide a link in the chat so that you can click it, but you can also scan the QR code if you have your phone, and that will connect you to the Rapid Research Pilot Program's site, where you can get a lot more information, a lot more detailed information. You can also register for a webinar, an informational webinar that they're going to hold around this grant on July 27th. So again, you can scan the QR code, or you can click the link when I add it to the chat to learn more about the Rapid Research Pilot Program. And again, this program is open to academic institutions, it's open to community-based organizations, HMSIs, so that's any historically minority serving institution, which would include HBCUs, tribal colleges and universities, universities that primarily serve Hispanic populations or other minorities, and also state and local governments, so health departments and things like that. Next slide, please. So the other funding opportunity that's available is the Community Collaboration Mini Grant Program. And this program really looks to support community organizations, faith-based organizations, tribal organizations, or even community-based clinics that are doing work to advance capacity, training, support with communities as you all are doing different COVID-19 testing initiatives. And this is really going to be focused on projects that are looking to or are currently, one, addressing, again, COVID barriers that are affecting the communities. And those barriers could be around communication. They could be around how to disseminate information, around data collection, outreach, any of those things. Also, it's looking for projects that are looking to develop communities of practice. So, if you're looking to work in partnership, or you are currently working in partnership, or would like to explore some, especially if you'd like to explore some partnerships with current Radix Up awardees or even SEAL program awardees, this is a good grant for you. And then also, if you're looking to just get additional funding for training, education, and personnel to support COVID-19 testing initiatives or education that you are doing currently. And so again, the mini grants are open to community organizations, faith-based organizations, community-based clinics, and any tribal nation organizations. These provide up to $50,000 in direct costs for a 12-month time period. And I will say the thing that you have to keep in mind, though, with the community collaboration mini grants is that you must begin the work within 4 months of receiving the offer of the award. So that's very important. Make sure that your project is either currently in the works or you are ready to start the work once you've been made aware that funding is available. And again, I will put the link for this project information in the chat, or you can scan the QR code. That will take you to the website where you can learn a lot more about this program. And you can also view some webinars that are there to learn more about the process, to learn, to get some guidance around budget development, and even learn more about what to expect after you are awarded the grant. So we really encourage you to apply to these funding opportunities. Just from what I've heard on the call, I think there are some excellent opportunities here that have been spoken about that would qualify for these grants, but we encourage you to go to the sites, learn more information. And the points of contact, where if you have additional questions, their names are on the website. So there'll be Kiana Watkins and Samantha Raines, and they can also address any additional questions that you might have. Please feel free if you have any general questions, and I will definitely try to answer those for you in the chat. And I will also put the links in. Thank you.
Thank you so much, Magdalene. We are excited to share these opportunities with you, and we want to engage in a quick poll. So in terms of prioritizing health concerns, so the poll is coming up. So prioritize areas of top 5 health concerns you would like to address. So we've identified 5. They include women's health, infectious diseases, violence and injury prevention, substance abuse, and mental health. And we'd like for you to take a moment to complete this poll. This will help inform future sessions, but also the work of Community Campus Partnerships for Health. So if you just take a moment to participate in that poll, and hopefully we can get those results up. We've had some challenges this afternoon with some of the connections, but take a moment to complete the poll. I believe our results are coming in, and I think we can share those with people. So are you able to share the results? Is it multiple choice? Yes, you must choose. Are you able to access it, hopefully? So some people are saying that they don't see a poll. Can you see the poll? You can also put your results in the chat box if we're able now to chat. Oh, yep, the results are up. So 69% said women's health, 65% indicated infectious diseases, 81% violence and injury prevention, substance abuse ranked 62%, and 81% of mental health. So thank you again for participating in that. As we wrap up today, we are going to run a little bit over. Hopefully you can stay. I really want to take a moment to bring Dr. Moore back. We had a really, I think, really interesting question around strategies to engage HBCUs. So Dr. Moore, if you're there, I'd love to hear your insight briefly on how you would recommend community organizations, how to connect with HBCUs, be it from a community organization or even other academic institutions.
So I will approach that from a couple of different perspectives.
Okay.
I think that if I take Prairie View, for example, so there are community-based organizations that have the opportunity to really participate and engage with activities that affect students directly by working with our Emergency Resource Center. And many of the college campuses now have those types of departments because we have really identified that food insecurity, housing insecurity, financial insecurity really threaten students' ability to successfully matriculate. And so therefore, we've had to figure out ways to really come in and put some stop gaps in place to assist students so that they can make it through or persist while they're here. And so that is an excellent way for community-based organizations to really come in and create those partnerships that can be long-term, but really have an impact to show that the way in which they are making a difference right there on the spot with many different students. I also think that for HBCUs, it's very important for community-based organizations to look at their opportunities to really help in the development. And when I say that, I mean in actually donating and hosting drives or hosting benefits that are really going to help raise funds for the institutions. As one of the presenters said earlier, many of these institutions have had the benefit of some temporary funds due to COVID, but those funds will be they will be disappearing shortly next year. And so because of that, those organizations are going to still have the same needs to respond to certain things on their campuses in COVID and other types of infectious diseases, monkeypox, things of that nature. And they will need those resources and the flexibility with the resources to actually come in and have programming and make a difference. And lastly, I think that one thing that community-based organizations can do is take a look at some of the student engagement leaders and see who has the program that is focused on providing service learning opportunities and civic engagement for the students. That's a great way to have a direct connection and provide a resource to students that allows them to come and give back and become active citizens and actually helping to advance the issues that your organization may actually support, but also the community that your organization supports. So again, it's through funding and development. It's through looking at the emergency resource centers and the partnerships there, and partnerships with programs that really focus on civic engagement and also service learning.
Thank you so much, Dr. Moore. I really appreciate that, and I'm sure our listeners do as well. We want to wrap up today, even though we do have some additional questions. We'll try to get to those, perhaps in a Q&A that we can curate and share with you, with announcements from Trey Mackey. Trey?
Good afternoon. I want to thank everybody for attending today. Just want to first and foremost provide my email. Make sure everyone have it. If you have more questions about details of today's session, that's Trey Mackey at ccphealth.org, ccphealth.org. Other information, more information about the HMSI Hub can be found on our website at the link there are provided. There you can find additional resources for HBCUs and activities and other programs that we have at our organization. A couple other announcements I'm going to share with you guys coming from the White House Initiative. Some links there on mentoring, student mentoring, family mentoring for students for the summer. Those opportunities are also there. We will be sending out, emailing a assessment for today's webinar. An email will go out, if not today, probably tomorrow. So look out for that. We are encouraging only one representative from your institution to complete that assessment. If you have any questions, please email me at my email in the link. You should see that email coming to you soon.
Thank you, Trey. I want to again join Trey and others to say thank you for joining us today for our inaugural panel. Unfortunately, we did not have an opportunity and time to take additional questions, but please contact Trey or find out more about Community Campus Partnerships for Health by visiting us at our website at ccphealth.org. ccphealth.org. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. I want to thank you for joining us for this webinar. Stay tuned for more information about our historically minority serving initiatives and about Community Campus Partnerships for Health. Thank you. Have a great day.